Hi everyone, and thank you for joining us for the first of what will be a four-part series exploring the role of medical cannabis and women's health. This is also the first webinar that Cannabis Health has hosted, so bear with me on that one. But we're delighted to be collaborating with Integro Medical Clinics and CPAS to bring it to you, and hopefully it'll be the first of many. So we're starting off with a bang and bringing you two topics which I think we can all agree sadly still have a lot of stigma associated with them, despite the fact that women make up half of the population and millions of people are medicating with cannabis in the UK every day. Tonight we'll be exploring women's pain and the struggles that they've faced in their journey, or more appropriately, their battles to get a diagnosis. It's now widely accepted that the current medical system fails to take into account the complexity of the female body. It only recently came to light that symptoms of a heart attack, for instance, present differently in women than in men. And studies now show that women are more likely to have their pain dismissed by doctors as emotional or not real. They have to make more visits to the doctor in order to be referred to a specialist. And once in A&E, women wait longer to be seen and are less likely to be taken seriously and classed as urgent cases. As a result, complex conditions are left undiagnosed and untreated for years. If doctors aren't aware of the symptoms of a heart attack might present in a woman, there's little hope for female-specific conditions which aren't widely studied in medical school. Endometriosis, for example, which we'll talk about tonight, takes an average of 7.5 years to diagnose, despite the fact it affects 1 in 10 women in the UK. When it comes to some conditions, such as vulvodynia, vaginismus, and pelvic inflammatory syndrome, some women even themselves don't know the symptoms due to a general lack of awareness and understanding. Perhaps it's not surprising that women are looking for another option. Since medical cannabis was legalized in 2018, many female patients have discovered that the rebalancing of their endocannabinoid system can be incredibly helpful in the management of their conditions, ranging from endometriosis, bladder and nerve pain, gynecological pain, and PMS, to mental health conditions such as anxiety, insomnia, and depression. Tonight, we'll discuss the realities of living with a chronic women's health condition through the stories of those with first-hand experience, as well as the obstacles facing women in our modern healthcare system and how these can be navigated. We'll also explore how cannabis medicines are helping them manage their conditions and the practicalities that come with accessing and the application of these treatments. So I'm Sarah Sinclair, apologies, I didn't actually say that at the beginning. I'm managing editor of Cannabis Health, and I'm now going to introduce this fantastic panel that I've got alongside me tonight. Abby Hughes is a patient, but also chair and outreach director of PLE, among many other hats. She's also an experienced NHS operations lead, a patient access consultant for Drug Sciences Project 2021, and co-founder of Plant Ed Collective. Abby lives with Ehlers-Danlos syndrome and a host of associated comorbidities, including fibromyalgia and POTS. She recently found out at the age of 32 that she's autistic and has ADHD. Laura, our second patient on the panel, who's chosen to remain anonymous tonight, is a reproductive health advocate and blogger with a dedicated following who writes to Endo Monologues, a satirical diary about her experience living with endometriosis and a number of other gynecological conditions from the point of view of her uterus, called Patricia. Her blog of the same name features many reviews as well as information and advice on a wide range of topics such as living with chronic illness, gynecological and sexual health, and mental health. I'm sure we'll find out a lot more about Patricia tonight as well as Laura. Our medical experts with us tonight are Dr. Sally Ghazala, a pain management consultant at Whittington Hospital and the National Hospital of Neurology and Neurosurgery in London. Sally also prescribes cannabis medicines and is women's pain expert at Integro Medical Clinics, which she joined earlier this year. Sally specialises in managing patients with a wide range of conditions, including neuropathic pain, abdominal pain, cancer pain, complex regional pain syndrome, and fibromyalgia. She has a particular interest in bladder and abdominal pain in women and women's health in general. Sarah Higgins, clinical nurse specialist with over 10 years experience working in the NHS. Sarah developed an interest in medical cannabis and its application in women's health following the implementation of routine screening for recreational drug use in sexual and reproductive health services. On exploring this further, she identified a trend in which women were often self-medicating with cannabis for hormone-related difficulties. Sarah is now women's health lead at the non-profit organisation CPAS Nurses Arm. So before I shut up and hand over to our panelists, who are much better at this than me, I will. There'll be an opportunity to ask questions at the end. So if you want to write a question in the chat, and I'll come back to them at the end, and we'll put them to our panelists. So first of all, we're going to start with Abby. If it's okay with you, could you tell us a little bit about your when you first started experiencing symptoms and what your journey to diagnosis was like?
Yeah, hi everyone. Thank you for having me as well. I'm really pleased that this event's been put together, so thanks. I guess it started back in secondary school when my periods weren't normal and I was told, oh, you've just got period pain. And I would be like crippled over trying to do PE and watching other people just managing. And like some days I could do the 100-meter and the 200-meter run and the 1500-meter run. Other days I literally was bent over in pain, unable to function, but just being told, oh, it's bad periods, you just have to put up with it, that's life. Okay. As I progressed and started having relationships and things, sex was painful, all, you know, throughout the month my hormones would be changing, and it just, again, oh, it's just your period, it's just your period, that's just life. And eventually in 2012, about 8 years after I'd first gone to the doctor about this. I mean, I've missed a bit out. When I was 14, I had an implant put into my arm. And maybe 6 months after, one of my sister's friends, my sister's a year younger, and one of her friends from school had an implant put in her arm. And my mom said, oh, that's a good idea. Why don't you think about that? And I was like, she actually copied me, but I didn't want to tell my mom because I thought she'll think it's contraception at age 14. And I wanted her to, you know, it was like this secret that I'd gone and got this implant to try and control my pain and stuff at that age. So yeah, 2012, I think I was 24. So yeah, that's even longer than 8 years. That's like 10 years, actually, it took me to be diagnosed. Eventually I got taken more seriously and I had a laparoscopy where they did some excision surgery and found I had endometriosis, not extensively, but not to the point where I had any organs stuck together, but on my ovaries, my bladder, my bowel. I had cysts removed from my ovaries as well. Luckily, they are intact, everything's okay. But I was told as a 24-year-old woman, just have a family now and have a hysterectomy. Or we can just, you know, we can just induce a menopause and put you on hormone replacement therapy. And I'm like, I'm 24, like, I didn't know back then that I was autistic and have ADHD, but you can imagine my kind of response, like, wait, what? Just have a family now and have a hysterectomy. What kind of advice is that to give somebody? That's not even a proven standard of care to get rid of endometriosis. There's no basis for that. And then with regards to other things which makes me feel like being a woman I wasn't taken seriously, I've then had all of this joint pain, this hip pain, all of these other things. And it wasn't until 2017 I was diagnosed with Ehlers-Danlos syndrome. And then all of the comorbidities that come with that, postural orthostatic tachycardia syndrome. Even endometriosis is more common in people with hypermobility. Being neurodivergent is more common in people with hypermobility. All these things have linked. I was working at an orthopedic hospital, a specialist hospital, and one of the physios went, you okay? You walking a bit funny? And I was like, yeah, I'm fine. And I was actually limping along and I didn't realize how bad my pain had become because I just lived with it. Mm. So I had hydrotherapy and physiotherapy and whatnot. And then it turns out my hip sockets are like this, like twisted. So I have acetabular and femoral retroversion, which means my hip and head of my femur are backwards. The angles are backwards. So I had just over 2 years ago, a periacetabular osteotomy and a femoral osteotomy to literally cut my hip socket in 3 places and twist it around, and to cut my femur, like they cut my femur and twisted the head of my femur, and I've got pins and big plate with all these pins. Oh, but it's just your period. Like, I was 30 years old when I had that surgery, and since I was 14 I was told it's just your period. So that's sort of been my journey. And then yeah, it took over 2 years to be seen by an ADHD specialist who then wanted to rule out autism but ruled it straight on in. So that's like, okay, but that all makes sense to me now looking back. But I do think that if I it would have been a hyperactive little boy at school, then it would have been different, because that's the set standard. So those have been like my journey to all these diagnoses, and it's been really emotional, actually. I just had to stop myself from crying right then, because it's hard work. It's really hard work, and no one realizes when you're just pushing through it all and masking your way through it all. Like, I'm in pain right now, my hip hurts, but I just live with it, because that's what you do. So yeah, that's
Yeah, I think that's really powerful there, what you said about you didn't even know that you were limping because you were just so used to living that pain and kind of masking your way through it. What toll has this taken, all of this? It's, like you say, it's been like decades you've been fighting for all these different diagnoses. What toll has that taken on you mentally and physically as well, I suppose?
Well, funnily enough, I worked in NHS management, in operational management, for nearly 10 years. And it wasn't liked that I was a patient in the hospital, but also trying to redesign the services that I was using. That was like a big, like, oh wait, someone who knows what all this means, and what, you know, I know what a periacetabular osteotomy and a femoral osteotomy is. That's just not normal language, but I'd worked in it, I'd been around all of that. It was a surprise to me that I needed that. Like, to be honest, I thought the surgeon was winding me up because I knew him, and I was like, what? I thought it's like the most invasive procedure in orthopedics, but it's just my period. So when you look back now and you think, hang on, it really makes you think, like, what if I had been taken seriously? What could my life have been? I got made redundant from the NHS because I was in chronic pain. Like, how does that work? I work in healthcare. We finally identified most of the things that are going on. We have a plan in place. I was on the waiting list for this crazy surgery, and their choice was to make me redundant. It wasn't like there was a redundancy package and a bunch of people got made redundant. I was singled out and made redundant. And I look back and I think I worked really hard. I was a manager by the age of 21 because I was challenging things and going, hang on, there's a can of worms, we need to open that. Why are we doing that in 10 steps when we can do it in 3? And I leapfrogged 2 of my bosses into a management position without a degree through putting common sense into things. And then when I got sicker and sicker, that didn't matter anymore. My skill set didn't matter anymore. I was just now a sick person. I wasn't an operational manager to them. I was a patient. I was someone that was on the waiting list that the managers had to look through. And that was really hurtful. I had a really tough time being made redundant. I had to fight for that. They tried to redeploy me into a role that was totally unsuitable given what I was going through. And fortunately, it turned out to be the best thing that ever happened to me, because although I found it so difficult and I had a huge breakdown around it, that then propelled me into wanting to do something better and wanting to do something more around it. So I'd already been around cannabis advocacy for a number of years, but wanted to put something in place with patients where we were a proper non-profit organisation that could really go in and make a difference and be taken seriously. We're not, a group of activists. We are a bunch of patient advocates with real lived experience who really want to make change. So that all of that sort of hurt and that, like, what's going on in my life, I spent my recovery from surgery plotting out how we can make this better. And then came along patient-led engagement for access, and we're a community interest company. We've got over 30 people in the team now who are mainly patients, and nearly all patients. Only one is not a patient, they are a carer. And now I still have days where I'm like, oh, what if this, what if that? But then I'm like, well, what if this and what if that? I'm looking to the future instead of into the past. But it still has a huge toll in your head, because you question things, and then you're like, oh, if I had known. And this is why I'm really, really super passionate about talking about these things, because if we don't talk about them, other women might not go and seek help. I did a talk on ADHD recently. I was only diagnosed in January, and I've already done a talk on it because that's just me. I even put, I don't know who I think I am, but ADHD has given me the confidence to do it anyway. So this is why I talk about this stuff. And I had over 50 women message me. Over 50 women were like, that resonates. Everything you just said, I wish I could put into those words, but you've just said it. And I didn't plan anything. I just pressed live and I was like, hi, I'm live on Instagram now, and here we go. And I just spoke. I thought I'd only have like 20 minutes. I spoke for 52 minutes because people relate to things and people want to hear stuff. So I'm really glad that this is happening. And yeah, I'll talk about it a bit later, but I've got a whole little side project about the ADHD now off the back of this, because my mental health has gone from being like to hang on a minute, I can make something good out of this, and I can really make change. So
yeah, I think the connection between mental health and physical health is really important, and your case is so interesting because you've been through that with both of these, and you've kind of had to negotiate being let down in so many different ways. What about your personal experience with cannabis? And I know you kind of had a relationship with it for a while. How has that helped you, and what kind of has that meant?
Well, in our family, Nanny Carol's herbal tea turned out to be deemed an illicit drug by the authorities. I was like, what? Cannabis is illegal? Like what? I was a teenager. I was like, but it helps her. Like she used this. She used to go to Jamaica for months at a time. And like she was the one who introduced cannabis to me. But to us, it was like we weren't allowed it, obviously, but we weren't shy of it. We knew what it was. So as a teenager, I was offered CBT and antidepressants and things. Oh, you're depressed, you've got anxiety. No, I've just got untreated ADHD, like, and I'm masking my way through life. And so I tried the antidepressants, but they weren't for me. The CBT wasn't for me. It wasn't personable enough. I just felt like I was there masking even more. So I started using cannabis, and that's what got me through. That is what got me through my teenage years, through being able to mask, through my job in the NHS. There's not a day I went to work where I hadn't used cannabis. Don't get me wrong, I wasn't waking up in the morning and smoking a spliff and then rocking up to the hospital, but I was medicating myself at night to the point that I'd wake up and still have the effects. By maybe 3 p.m, I'd be like dying to go home to have some more medication. And I didn't realise until I got diagnosed with endometriosis that I was using this to medicate. And it's only when I was diagnosed with ADHD and as autistic that I really was like, oh God, I've used it as medicine the whole time. No wonder I wanted to use this as a teenager. Have you seen the inside of my brain? Like I've done a drawing of inside my head and it's just like, it doesn't stop. I don't stop. You know, I'm talking quite a lot. You might tell I went to talk. But this is what's going on inside my head the whole time as well. So cannabis for me has always been what's grounded me, what's enabled me to swallow that emotion sometimes and carry on talking instead of just getting upset. It doesn't dim my emotions to no emotions. I will definitely cry by the end of this talk. It always happens. Surprised it didn't go when I mentioned Nanny Carol, to be honest. But cannabis is what's enabled me to push through, enabled me to chair a community interest company, to look after PLEA, enabled me to recover from my surgery. I mean, I swapped tramadol, amitriptyline, dihydrocodone. I was offered fentanyl patches. That's not even including the gabapentinoids and the antidepressants and all the other things and the stuff to, you know, oh, you're going to get constipated, so you have to have this. I've got off this barrage, this cocktail of drugs where, ironically, I was off my face on drugs. Imagine me trying to run the largest bone cancer centre in Europe on tramadol. That's what my life got to, and that didn't work. That was not sustainable. So yeah, it was like, well, I realised how much I was using cannabis as medicine, and that's what I did. I carried on, and then I would be like, oh, Professor Oncologist, have you seen the study about the endocannabinoid system? That's magical. Like how, like, and I'd act like I didn't know anything about it. And in the end, they'd be coming to me and going, oh, have you heard about this? Have you heard about that? My patient spoke about cannabis today. And I'd be like, thinking, yeah, I'm bloody, can you not tell? I'm using it. And this is why I'm feeling so good today. And it got to the point where I could then start, like, I confessed to a bunch of colleagues, and that was totally at risk, but it never came up as a problem at work. Many people aren't fortunate to be able to feel like they can talk to their colleagues about it, but I can't shut up, you might tell. So I couldn't help it. I wear my heart on my sleeve, and I wanted them to know that this is why you might be doing this operation on me, but this is what's getting me to the point of managing the pain to get to the point of the operation. A lot of people are on opiates in a wheelchair, can't walk in this situation, ironically, because they are blitzed on opioid medication, whereas I got to the point where I felt like, as soon as they offered me fentanyl, I was like, right, I'm going to stop everything now. And it was a big change into cannabis. And then getting a cannabis prescription last year was the real game changer for me, because from the illicit market, you don't know what you're getting. I can't grow. My aloe vera plant's nearly dead. I don't. If people want to grow their own cannabis, got no problem with it. But I want my doctor to understand what I'm being prescribed, why it works. The fact that I am not seeing 68 ologists and specialists now. I lost count of the amount of specialists I was seeing. I genuinely made a spreadsheet and couldn't even keep it updated because I was just. I remember one day I had 3 hospital appointments in one day at 3 different hospitals, and I made it to them all somehow. But this was. I was seeing so many people and they were giving me so many drugs, and it just got stupid. Now I see one pain management specialist and I'm prescribed for pain and anxiety. And I have one flower that I use in the day with the CBD oil that I take throughout the day. And I have one type of flower that I use of an evening. And my insomnia flipped itself on its head, because in the illicit market, I was getting whatever could be sold to me from whoever could sell it to me. I've had £20 taken off me and people have driven off in the past. My friend's been spat in their face as someone's robbed them of they gave them the cannabis and then robbed it off them with their money. Like that's the reality of the illicit market. And for me, being able to access something, although it costs an arm and a leg, it is a private prescription. It's been a game changer. The only thing that has been, sadly unavoidable is sometimes some of the products aren't available. So I've got used to this. Oh, great, my life's changed. And then all of a sudden my nighttime medication wasn't available. Then it was. Then my daytime medication wasn't available. So then I went straight back into insomnia. Now, fortunately, I've got both again and I'm leveling back out. But the past few weeks where I haven't had my daytime one again, I was getting up at like 2 p.m, 3 p.m, just staying in a dressing gown all day, not functioning. But now I've just been using my Volcano before I come in here. I'm not sitting here stoned, am I? That cannabis has made me go, yeah, woo, let's go. I want to be really productive. I want to crack on and get things done. And that to me has been the biggest change ever. So yeah, going from someone who was sad on a bunch of opiates, my weight was just awful as well because I couldn't exercise. I had no motivation for anything, to now just being able to go and see one specialist to get my one type of medication. And I'm doing better than anyone, like not anyone, than I ever have. There we go. I'm going to stop talking now because otherwise I'll take a whole hour and we'll be finished.
You are doing incredible. You are doing incredible. Absolutely. Yeah, I'm going to open it up to the panel now. And Dr. Ghazala and Sarah, if either of you want to come in with your thoughts on Abby's story and how this compares to what you see in your clinics.
Can I say something?
Absolutely.
Yes, so he is Sally. My name is Sally. I'm a pain consultant, and I really do agree with Abby about if we don't talk about things, nothing will change, nothing will happen. Mm-hmm. And as I said, as a woman, from the Middle East, there are a lot of topics we don't talk about it, and especially pelvic pain. We don't talk about pelvic pain. Lack of knowledge, I think, at the primary setting, feeling rejected, ignored, being blamed about a condition is not because you're having the period, it's your period pain. It will get better after a few days, 5 days, you will be fine. So they always connected to a period pain. So they don't want to investigate further because you are a woman. And this is part of being a woman, is the period pain for a few days and it will pass. And that's why after being, I think women are still in pain, going to the GP. And it takes years to listen to them and to accept there's something wrong there. It's not just the period pain. And by then they need to send them to a secondary care, setting. And it takes years for this to happen. And by the time this woman or this patient, female patient, goes to the secondary care, she will be suffering for a few days, a few years, physically, mentally, socially, every type of suffering, not just physical pain, is the whole bunch of it. And it's really sad to see women, if they talk about, oh, I have pain in this, oh, it's okay, it will pass. But if a man talks about pelvic pain, oh, we have to investigate further because maybe this is something wrong there. It's maybe cancer or something more serious. And I see it a lot actually in female patients. It's really sad to see, is because of years of being rejected, ignored, and being not listened to. It takes years for them to be diagnosed with endometriosis or vulvodynia or any other thing, and this years it will affect them mentally, plus the physical, of course, plus the pain itself. This is my experience.
I was just gonna, sorry, Sarah, you go.
No, after you, Sarah, go ahead.
I was just going to say, Sally, when you're prescribing with Integro, do you see a lot of women that are kind of coming to you that have had this experience and this is sort of a last resort for them?
Oh yes, I have to admit, this is cannabis is very new thing to me. I just started this year, actually, in the beginning of April, and I had some few women, yes, with the pelvic pain and endometriosis, and she said, as Abby said, that she tried everything, she done everything, she had injection, she had medication, and this is the last thing she would like to try, because she is really suffering from the pain and from the the mental effect of pain, and she finds this cannabis as a last resort for her pain. And I have to say, I was amazed by the feedback from the cannabis. One of them, they said it's a life changer, as like you said, it's changed my life. And I was really, because I have to be honest here, I didn't know what is endocannabinoid system when I was in medical school. I wasn't taught. I didn't know what is endocannabinoid. We haven't been taught that endocannabinoid system, it does exist, and it exists in the uterus, it exists in the pelvic in the pelvic area of a female, and it has an action, it has a big role playing in reducing your pain. So I haven't been taught. I didn't know endocannabinoid system until recently, and I have to admit. But I have to say, I was amazed by the effect, the good effect of cannabis for women and patients in general. Yes.
Yeah. Sarah, yeah, you obviously see a lot of women in your clinic. What's been your experience?
I mean, unfortunately, I think Abby's story is not unique. I think that there are lots of women that go to the doctor multiple times over several years before they get the diagnosis that they need. I think Abby is 100% correct that if she was a young boy with ADHD, it may have been picked up in the education system. And I mean, I was thinking about the ADHD in terms of Abby's story and thinking, you said you fast-tracked through the NHS because you were able to problem solve and say this. So in some ways it probably worked as a benefit to you. But in other ways, I wonder, you know, what kind of impact that had on your concentration in the classroom, your way of managing physical illness that can kind of slow you down when your mind is on a completely different level to what your body's doing. So there's no synergy going on there really between mind and body that can also cause frustration. And then on top of that, having the implant at 14, having the irregular bleeding, the mood change, I mean, it's a lot. And I think for your formative years, it's almost like you form into an adult with the resilience to manage these conditions, or at least that's how you present at the moment. But it won't be the case for all females, you know. To have a spreadsheet of different ologists to go and see and the number of medications, just out of curiosity, Abby, how many medications were you on and how many medications are you on now?
At one point, I think I was taking about 5 or 6, and some of them were on rotation, and I'd stop one, then try another one. You know, diazepam would be like every 3 or 4 weeks after a whole week of insomnia where I was doing my own head in and I just needed a week off, then the diazepam would pop in and stuff like that. And now it's literally CBD oil, THC flower for the day and a different THC flower for the night.
It's the same with medicines. And you were able to talk to people, so you kind of had access to clinicians who were oncology, so were kind of probably a little bit more open-minded to cannabis medicines. What would you have liked from your clinicians? So did you ever say to your GP or any of your others?
I saw a pain management specialist, and the first thing he said to me was, "You work down the road, don't you, at the orthopedic?" And I was like, "As do you?" Like, if I'm correct, because I knew he was an anaesthetist at the same hospital I worked at, but I was seeing him at a different hospital as a pain specialist, and he didn't like that. he instantly took a dislike to me. And I said, I'm here today to talk about cannabis and cannabis only. I've tried every medication that you want to give me. I wasn't rude about it, but I said, here are the nice guidelines. Here is this, here is that. I understand you might not be able to prescribe it to me, but I want to have a conversation with you about it. And his words were, I wouldn't prescribe that even if it was licensed. And I was like, have you just heard the words that came out of your mouth? And I cried and I just left. I left the appointment, and he wrote me the cruddiest letter ever from that appointment. And he had like put in bold writing all the stuff about cannabis and how bad it was. And I just laughed and I just thought, more for you being a pain specialist with that stinking attitude. My GP thinks the UK is 10 to 15 years behind. Her dad is a gynecologist, specialist gynecologist, so she's very not into women's health, very well read on women's health. She understands it very well. And she was just like, I applaud you, keep doing what you're doing. One day the law will change. I'm just so sorry that I can't provide this to you, but I'm thankful that you're open with me about it. Out of all of the specialists I've seen, I've told all of them that I use cannabis, and only one, that one stinking pain management, we'll call him, he was the only single one in like over 25 specialists that I've seen. He was like, nah. All of them were intrigued, wanted to know more. I would also say, oh, have you heard about the endocannabinoid system? Rather than be like, oh, cannabis, boom. I'd ask them, have you heard about the endocannabinoid system? Do you understand what that is and why I want to talk to you about this? So I think the approach that I knew to take helped, because I've put a link in the comments and I'll put it up again later. We've got a resource around talking to your doctor, because a lot of doctors have the same stigma. They have the same fear we have about opening up and talking to them. Patients are worried about talking about cannabis. Well, doctors are worried about talking about it as well. They don't want to lose their GMC registration, or they don't want to, kick up a fuss amongst colleagues. People just want to keep the peace. Well, I'm sorry, I am not one for just sweeping things under the carpet and keeping the peace. I'm one for sticking a flag in it and being like, hey, this needs sorting out. Like, I wasn't just pointing out cans of worms, I was opening them and pouring them over people's desks and saying, this needs to change, this isn't right. So yeah, I think most specialists were really interested in talking about it. They saw the progression in my abilities and the things that I was able to do, where they'd seen how I'd reacted to all these other painkillers. They'd seen me become like a shell of myself. I wasn't all bubbly and like, la, 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 like this. I was literally sat in pain. Yeah. And that was that. Like, that was my life. And it came to the point where I was struggling to get to work on time. I was struggling to do the work. Like you say, my brain is like, but then my body's like, out, everything hurts, it can't move properly. That whole combo was like, it's scary. And I'm really grateful that a lot of my doctors took the time to listen and understand it. And hopefully now the law has changed, a lot of them will be more able to have, to further their conversations around it. Or going on a tangent now, because I can't remember what you actually asked, which is a big thing about ADHD that is bad. Like, my brain is like, don't know what's going on.
Answer the question. All right.
I think, Abby, you raised a really good point there about advocacy, which is obviously when you need to be doing this both as a medical cannabis patient and a chronic illness patient, advocating for yourself. And you obviously kind of knew the system a bit, but for those who don't, and to Sally and Sarah, what can women do to navigate that system, and how can they kind of be their own advocates?
I mean, as Abby said, you have to keep talking about it and really spread the word. I mean, don't be shy about asking, or just. I had a patient 2 years ago actually, and she told me she's prescribing cannabis, and can you prescribe? At that point we couldn't, and I went to ask another colleague of mine, can I send her to cannabis? There was some cannabis actually, and he said, no, don't even talk about cannabis. I said, but the patient said she is okay. I mean, it is helping. Why can't I talk about it? This was 2 years ago, and the kind of it's a taboo. Don't talk about cannabis. No, it's not something you should prescribe. This was 2 years ago. But as Abby said, talk about it and spread the word. This is the best thing, and don't be shy about just expressing your opinion. This is what I think.
Yeah, I would always encourage women to get a second opinion. If you're not happy with what somebody said to you, seek a second opinion. Take somebody else with you to your appointment, so that in the moment that you feel that you're being shut down, if someone can give you that little bit more confidence to challenge the person in front of you and say, actually, no, I'm unhappy with that as an answer. Could you explain that a little bit more? I think that's always helpful as well. Not all clinicians are bad eggs. I mean, it's a few of them, and sometimes the pressure of the systems that we work in with the time limitations. And you know, if you're seeing a GP and you've got something that you want to be addressed, book a double appointment. Don't book one appointment, tell them you need two. You've got multiple issues you'd like to discuss.
So as you're right, is the time you really, it's not that sometimes it's not I don't want to, it's the time is very limiting for you when you see 15 patients in one day. And this is, you need to listen to, especially chronic pain, like me, chronic pain patient, you need to listen. Because some people, a lot of patients, they come to see, at least you listened. A lot of patients, a lot of doctors, they don't believe me I suffer from chronic pain. And there are a lot of parts in the world. Last night I was talking to a friend of mine. They didn't even know what is chronic pain in a different country. I said chronic pain is like this and this, and I said, what does that mean, chronic pain? So they didn't even know what is chronic pain. It's the different culture, different perception of everything. So it's just, yes, it's double appointment, yes, because it's just a time limiting, and there's no time sometimes to just to have your time with the patient.
I think it helps to obviously stand your ground with it and be firm, but be fair to the doctor. If they've never heard about cannabis other than the negative connotations, well, how are they to know? And they are going to be dubious if you're sitting there going, I want cannabis. Cannabis is great, because they don't know that themselves. So like I mentioned before, just maybe going in and talking about the endocannabinoid system and asking questions rather than pushing for it and saying, this is this and I want that. Did you know this? Have you heard about that? Have you seen this study? And just asking in a language that doctors understand and or clinicians, the wider term, asking in a language that clinicians understand, I think can really make them go, oh, actually, yeah, as a clinician, that's something I should know about.
I'm just going to bring in Laura now, because I think this is quite a good opportunity to tell her story, and then we can kind of have a wider discussion with everyone involved. So Laura, would you like to tell me a bit about your journey to diagnosis?
Hi everyone. Mine has quite a lot of similarities with Abby's, if I'm honest. It was a very long-winded journey to kind of finally work out what was going wrong with my body. I mean, I started my periods when I was 11, and by the time I was 14, my periods would last 2 months at a time, and I would be soaking through a nighttime sanitary towel and the highest the largest size tampon within the space of an hour. And as a result, I ended up becoming anemic, and I was missing school. And my mum, love her, she said, like, enough is enough, we need to get this sorted. And for me, it's interesting because my mum had already warned me, you're going to start your periods young, and I'm not going to lie, they're probably going to be horrendous. So I had kind of resigned myself to the fact that that's how it was in the family, because I knew that my aunt was the same, and my grandmother. And at 14, I went to see the first doctor for the first time about my periods, and he immediately reacted by just putting me on the contraceptive pill. And it was the same, oh, it's your hormones, oh, it's puberty, oh, it's probably just a bad period. And it wasn't until my mum kind of said, so you're telling me that a period should last for 2 months at a time, he kind of went, oh, well, no. And then it just kind of progressed from there and kind of got bounced from pill to pill when kind of the symptoms kept creeping in. But it wasn't until my early 20s that kind of things really ramped up. I mean, I was diagnosed with a underactive thyroid when I was 16, and that's when the doctors kind of said, oh, that's probably where your period issues have come from. And at the time, you kind of accept your doctor's opinion as gospel, which, well, I'll get back to that. But I trusted that was what the problem was. But as I said, when I was in university, I was probably on my 5th, 6th branding of contraceptive pill, back to heavy, horrific periods. Yeah, they were shorter, but the amount of blood loss that was going on during that kind of short period went back to being anemic. It then became painful to have sex. I couldn't have penetrative sex at all. I had shooting pains from my pelvis down into my legs, painful bowel movements, and everything just felt very tight, and there was no kind of flexibility. And so I went back to the doctors, and I kind of explained this in brief to my doctor, and he said, oh, well, I know that all the ladies have heard this before, but the first thing he said was, oh, well, women who are promiscuous often have period problems. And I hadn't told him about my sexual history. I hadn't even told him if I was sexually active or not. And at the time I wasn't, because I couldn't have sex. And when I kind of tried to get to the bottom of why he would say that, he just said, oh, well, young women these days are more liberal with their bodies. And I was like, well, that aside, that isn't going to be causing my period issues, and he went, well, let's do a full sexual health screening panel. Let's do a pregnancy test. And I was like, I've literally did that last month. I'm not pregnant. I haven't got any STIs. I haven't got any STDs. But I went along with it, and a couple of days later, had the whole swabs, legs up in the air, you name it. And then another doctor rang me back. So this was this kicked off September 2015, October 2015. So by that point, I'd been dealing with period issues now for nearly 14 years. And this other doctor rang, and he said, oh, hello, everything's come back fine, but you've got thrush. And I said, okay, that's fine. I know what to do to deal with that. What about my pelvic pain? And he said, what pelvic pain? And I said, the pelvic pain, which is why I went to the doctors in the first place. And he said, oh, I didn't know about that. But to his credit, he then referred me to a transvaginal ultrasound. I had that. It was really uncomfortable. It didn't help that the doctor who did it was incredibly good looking. And then Christmas Eve 2015, I had a voicemail left on my mobile by, I call him Dr. Promiscuous. And he said, everything's come back fine. You've got no polyps, you've got no cysts, everything is fine. And I kind of was like, well, that doesn't really answer my problems. Why, it hurts to go to the toilet, it hurts to have sex, it hurts every frigging day. And I kind of left it for a bit, because I just wanted to, think about how I felt in relation to it, not knowing actually what Abby's just said, that ultrasounds don't show anything, because they don't. Sometimes they do, but a lot of the time they don't. And March 2016, I went back to the doctors. I had an ear infection, and it was a different doctor. It was a female doctor this time. And I said, oh, no one actually went through my results with me in person. And she said, oh, you've just got a thickening of the uterus. And I said, will that affect my fertility? And she said, no, it's absolutely fine. You've just got a thicker uterus. And at that point, I kind of just accepted it. I kind of had a reason to what my problems were, and went along with it. And then, thinking that I had the answers to it, time went by. And then June of 2016, I went to have kind of one of those run-of-the-mill, let's check your blood pressure, let's check to see if being on the contraceptive pill is still suitable for you. And was having a chat about, how I was getting on. And she said, oh, just been reading your notes. Are you on the pill because they suspect you've got endometriosis? And I went, sorry, what? And she went, well, that's why you're on the pill, right? You're on because they think you've got endometriosis. And I said, I've never heard that before in my life. What are you talking about? And then she turned the computer screen around, and there it was, black and white, that since my transvaginal ultrasound, in October, they had suspected that I had endo and nobody thought to tell me. So at this point, and actually now, like Abby said, you get emotional talking about it. I remember having the hugest meltdown in the doctor's office, and it was this mixture of knowing that something was wrong with my body, but actually so frustrated because a doctor had been grossly incompetent, and not just one doctor, a series of them, because they would have all had access to my notes. And I put a formal complaint in against him. As far as I know, he's no longer a practicing doctor. I was rushed through for a gynecology appointment, and when I put my complaint in to the doctor's surgery, I kind of got a half-assed letter saying he was sorry, but then their justification was that he was talking to me the way that he would have spoken to his daughters. And I turned around and said, my dad would have never spoken to me like that. And even if that was the case, that's not professional. I'm not his daughter, I'm a patient. My mum is she doesn't take any shit. Oh, I don't know if I'm allowed to swear. She doesn't take any she doesn't take any mischief or being messed around. But the funny thing is when I went home and said to my mum, this is what happened, she went, oh, I've got endometriosis. And it was like, hold up, mum, what? But she had, my mum, bless her, when I was 16, she had an ovarian cyst removed. It was 50 centimetres long. And it was full with 1.5 litres of fluid. And the surgeon had said to her then, oh, you've got endometriosis, but it's nothing to worry about. But we hadn't put 2 and 2 together that my mum actually had an official diagnosis of it as well. So then, as I said, I got referred straight away to a gynecologist. I had to have another transvaginal ultrasound, which I actually passed out in because the pain had gotten so bad. And then August of 2016, I had my first laparoscopy. I was diagnosed with stage 4 endometriosis, deep infiltrating endometriosis. My ovaries were immobile, they were glued together. It was on my pouch of Douglas, it was on my bladder, and it was all over my uterus and my ovaries. I was also told that it was incredibly likely that I had adenomyosis or adenomyosis at the same time, which explained where the doctor had said the thickening of the uterus. But my gynecologist said that I should have been referred to her like 5-6 years ago. It shouldn't have got this bad. And I had the Mirena IUD inserted at the same time, and things were fine for a while. And then I started to tear when I had penetrative sex. And the idea of anyone kind of coming near me sent me into a really emotional state. And I got referred to another gynecologist. So I went back to the doctors and I said, right, you need to refer me to gynae. I don't want any of your bull. Like, I just want to talk to someone who knows what's going on with my uterus and my vagina. So 2017, I was formally diagnosed with vaginismus, post-traumatic stress disorder from the pelvic exams, painful pelvic exams. And I was also diagnosed with vulvodynia. I had absolutely no idea that I had been living with vulvodynia for probably 2 decades. No one had said to me about the burning of your labia or anything like that. And it wasn't until the doctor said, oh, do you experience this? And I went, oh yeah. She went, yeah, that you've got vulvodynia as well. And I was like, great, add it to the list. And then so in the last year and a half, my periods have started to reappear even though I'm on the coil. My pelvic pain had come back. I couldn't have sex. So I actually had a second laparoscopy last year. It got pushed back because of COVID. And they found that my endometriosis, it had grown back on my pouch of Douglas. It had grown again on my bladder. This time it had spread to my bowel and my ureter tubes, and my ovaries were immobile again. So I've had it all excised again. And that's kind of where I've gotten to regarding my kind of medical history. I think I'm immune to it, if I'm honest. The amount of times now I've kind of spoken about it, but I always find it really interesting when I tell people and they're like, well, that's really bad. And I'm like, yeah, it is actually, isn't it really? But if I don't laugh about it, I cry, and I've cried too many tears over the fact that I've got a broken uterus. So yeah, and I mean, in terms of CBD and cannabis, I'm actually a very new user to medicinal cannabis, but I've been using CBD for a good couple of years now. I heard about it by another kind of person in the endo community, and specifically went to London to hunt down the shop that sold the particular brand I wanted. I actually started with using CBD lube because I heard that would make having penetrative sex easier. And I found out as an addition to that it actually helped soothe my vulvodynia as well. And then ended up kind of switching to an oil and vaping it. And I am now, in terms of my medicinal cannabis, I am using both a THC oil, a CBD oil, and I also use flower mostly in the evenings if I'm having a flare up with my pain.
Thank you, Laura. Thank you for sharing that. Every time I hear that, I've heard it about 3 times now, but I'm just shocked and so angry every time I hear it. I just wanted to ask a bit about what your symptoms are like now you're on medical cannabis and now you've got a prescription.
They've definitely improved. I mean, if I'm honest, I had smoked it recreationally in the past, and as Abby said, I never really realised that it was actually helping my pain. So in terms of like what my normal pain is, I have sciatica pain, so I always have like throbbing, shooting pains from my lower back into my hip and pelvis. I quite often get pins and needles in my pelvis. I also will have like uterine spasms, contractions. I get what I call butt lightning. So if I have like a bowel movement, it'll get like a shooting pain in my rectum. And yeah, just kind of all the associated pain, I suppose, you would have with a period, you know, menstrual cramps and whatever. In terms of how cannabis has helped, I'm no longer having to use over-the-counter painkillers. I don't have to use those anymore. And I sleep so much better. I'm not being woken up in the middle of the night because of my pain, and I function. I mean, obviously, I should say that the reason that I'm anonymous is because of the industry that I work in. I have to be very careful to safeguard myself, but I'm on my feet all day. And before I was using cannabis, I would be in agony by the time that I got home. I now come home and I'm not, you know, I'm not in pain that I have to go and lie down. I'm not immobile. I'm not exhausted. I actually feel like a functioning human again, rather kind of being controlled by my pain, which has been incredibly liberating. And it has, I mean, CBD changed my life. Medical cannabis is like the next level. Like, I don't know how I coped before without medical cannabis. And I find it so shocking that, you know, I could easily go to the doctors and be prescribed morphine or cocodamol or codeine without an issue, you know, without anyone batting an eyelid. But to be prescribed medicinal cannabis is, you have to go through hoops. And there is something seriously wrong with the way the system is in this country and globally, I think, as well. I know it's a big issue in the States. So yes, I love the fact that I now legally can take a medicine that allows me to feel like myself again, not someone who's got a chronic illness, who's got chronic pain. I'm back to being Laura. I'm back to being someone who, you know, can actually have a social life. Not at the moment, obviously, but who can go out and about and see people and not having to cancel plans because I'm in too much pain. So yeah.
And I just want to go back just before we open it up to everyone else to what you said about when you had a meltdown in the doctor's office, because you were angry, but you were relieved that there was something there. Did you spend most of your life kind of thinking that there's something wrong with you and feeling sort of shame and as if it was your fault?
Oh, absolutely. I mean, thank God for my mum, who kind of said, you know, not gonna lie to you, your periods are gonna suck. So I kind of had that in my head, I think, from the moment I started. But no one ever, you know, said to me when I was growing up, this is what, and I'm sure it's the same for all of you, this is what a normal period should look like. This is what your body should do. And no one spoke about it when I was younger. I couldn't say to my girlfriends, oh my God, I'm having such a horrendous period, because I felt ashamed of the fact that I was having a horrendous period, you know. And you go to the doctor and immediately it's, oh, well, it's your hormones. Oh, it's puberty. Oh, it's just a bad period. And you're conditioned, I think, that you have to trust what your doctor's saying. I don't feel that way anymore, but when I was younger especially, you know, you go to the doctor and you think, oh, okay, that's what they've said, they're trained, they're a professional, of course I'm going to trust them. But I got told, you know, that it was because I was overweight, or because I wasn't getting enough sleep, or, you know, it was just my hormones, or because, you know, I'm promiscuous. And you feel ashamed. I think, you know, a huge part of your identity, or my identity, is the fact that I am a woman and that I have a uterus, you know. And when something goes wrong with your gynecological system, your reproductive system, you feel shameful about it. You feel like something's wrong with you, and you're made to feel like it's your fault, that you've done something to cause this, when actually you've just got really crappy DNA that, you know, I've inherited this kind of condition from someone who has the same thing. And even when I got told that they suspected that I had endometriosis, there was no apology. There was no kind of, oh, you were right, Laura, that something was wrong. I just got made to feel like I had to defend myself as to why I was making a complaint, because why some absolute muppet thought it was okay to A, label me as promiscuous, and B, not listen to what I was saying. So yes, it was incredibly validating hearing that. And, you know, the nurse who actually still is at my doctor's, you know, she sat with me for 20 minutes and she Googled endometriosis, and she went through on the system with me all the symptoms, and it was like, oh my God, this all of a sudden makes sense. You know, there is actually something medically wrong with me. It's not just because my uterus, you know, hates me. And I think that is still an issue today, you know, that we don't get told enough that we can actually challenge our doctor and say, okay, well, that's your opinion, but actually I'm going to go for a second one because I don't think you've got my best interest at heart. Or actually, you're not listening to me. You're not listening to what I have to say. So I think it's incredibly important that we do that, and actually just to remember that doctors aren't always right. Doctors actually sometimes have absolutely no idea what they're talking about. Present company excluded.
I was just going to bring Dr. Ghazala in there, and as a clinician, what do you feel listening to Laura's story, and what are your thoughts on that?
I feel very, really sad and upset and frustrated that a woman, especially women, we have to go through all of this disbelief and feeling rejected and feeling blamed that you are a woman, you have a uterus. And I 100% totally agree with Laura. And it's really upsetting, and especially women or patient with chronic pain. It's really sad and very frustrating to live in chronic pain for years and years and years and not being believed, because chronic pain is something you can't see. And the other thing, as she said, it's hormonal. And the other thing that they said, oh, you are stressed. The other thing, if they don't find anything, the other thing, oh, you're stressed. Are you stressed? No, I'm not. I have some pain. I'm not stressed. I am in pain. And it happened to me personally. It happened to me. I had very severe pain here, and I said, oh, you're stressed. I ended up having shingles. Severe shingles, and they put it in, I'm stressed. I said, no, I'm not stressed. And this is the thing. So either hormonal or either you are stressed. So I really am sad and upset hearing women had to live for several years to have a proper diagnosis and to be heard and believed.
Yeah. Sarah, do you want to add anything about that?
I mean, it's, you know, hearing Laura's story is very saddening. I mean, the common theme that both Laura and Abby talk about is that when they see clinicians, all the responsibility is put back on them. So it's, you're promiscuous, you're not sleeping enough, you're stressed. It's never that actually you may have this organ, this uterus, which Laura's named Patricia, and rightly so, because it has a mind of its own that could be causing you all these other issues. And that could be having a much wider impact on everything. It's also sad that when you go somewhere and you say, actually, I've recently had a sexual health screen and it's negative, that they insist on repeating it again, because it implies that they don't believe your history, or that we are so focused on a medical legal scenario that we forget that we have a patient in front of us. Yeah, and lastly, I mean, a relationship with a clinician should never be paternalistic. It's supposed to be a partnership. So as a clinician, you can never turn around to someone and talk to them as though they were your child. It's not your child, it's your patient. And it gives a completely unfair power dynamic in a relationship. And yeah, sadly, that's what Laura experienced.
On reflection of that, I've just remembered that in September, I had a telephone consultation with my gynecologist, and he was like, right, I'm going to get you in urgently for an examination, but first you need to do an STI test. I was like, and I'm still waiting for this urgent appointment because everything hurts so much. And that was his, yeah, I'll just go and get an STI test first. And it's like, okay, well, why? Like, I've come to you with the same problem. It's not, it's just mind-blowing, isn't it? And I just wanted to say to Laura, I used to have 10-week periods, so I just wanted to like relate to you with that, because it's, I don't know if we're allowed to swear, but it's messed up. That's the safer word that I'll use. And I want to hear more about the endo monologues, because for me, my way of dealing with this, I actually turned to stand-up comedy. And I took myself and did a course, and in front of 450 people spoke about endometriosis and my 10-week periods and my quest to find something better than tampons because they wouldn't fit inside me anymore. So yeah, I'll share a link in the comments if anyone wants to watch it. But I really want to hear about how you channel your experiences into the endo monologue. Sorry, I'm totally taking over here, but I'm like really want to know more about it.
No, go for it. Just feel free to like jump in and anyone can ask questions. That's that's perfect. Yeah, Laura, tell us about the endo monologues and how that started.
So I was at work, and it was, gosh, what year are we now? So it was 2019, and I was having the worst endo bloat I've had in a long time. Like, I looked 6-7 months pregnant, and I was doing something really trivial. I think I was photocopying something, and a colleague of mine who I hadn't ever spoken to really, especially not about what's going on in my body, she leant forward and she said to me, "Is that a bump I see?" And I kind of looked at her and said, "Sorry." And she went, "Oh, is that a bump I see?" And I was like, "No, it's not, but thanks for making me feel really fat." And I kind of just walked off. And then I was down the pub with a couple of colleagues, friends, whatever, and I had relayed this story, and the conversation kind of went about, and I went, "Do you know what? It'd be, sometimes I just wish my uterus could talk and just tell me what's going on." And a couple of weeks later, it was New Year's, I'd had 1 or 2 maybe to drink, and I thought, do you know what? I'm going to do this. I'm going to start an Instagram talking from the point of view of my uterus. And she's called Patricia because I live on a farm, and we have a really, really sassy chicken who is called Patricia. So that's where the name came from. And if I'm completely honest, I started it as a wellbeing project for myself. It was very much a way for me to deal with my emotions and kind of process how I was feeling and what I was going through. So it just started with me doing these daily diary entries as I was Patricia. And then people started reaching out and saying, oh my God, I need to name my uterus as well. And I completely understand where you're coming from. And it just grew. And I ended up starting to talk about CBD because I found it incredibly useful. And then people started saying to me, oh my God, can you please post like longer posts and talk about it more? And I mean, if you said to me back in January of, a year and a half ago, that I'd be on my way to like 15,000 followers, I probably would have laughed in your face. And it honestly, it just boggles me. And I'm always so touched because people always reach out and say, the way what you said, what Patricia said today is exactly how my uterus is feeling. And it's so helpful to know that I'm not going through this alone. And it's actually really lovely to be able to laugh about something that really, really sucks. And I think I said it earlier, like, I have to laugh about it because otherwise I will just cry every night into a glass of wine because it sucks. And the fact that it's now not just an Instagram, but a blog as well, and people share my work with other people. And I think that it's just this lovely sense of community. And, I love hearing what people have named their uteruses. Like, I find it fascinating that it's kind of become this thing. And yeah, it's incredibly overwhelming. Like, I get emotional talking about it because it has connected me to so many wonderful people. And, being able to talk about it in a way that I'm not being judged, and in a place where I can really, really be honest and say, do you know what? Today has really, really sucked. And I type it out and I immediately feel better because I've got it out of my system, I've processed it. And then, people will message and say, yep, I'm feeling this way today. And, oh, I'm sorry you're feeling this way. And yeah, it's just evolved from that. And, I now try and have the educational side of it because there's so much misinformation out there, where people say that having a hysterectomy will cure endometriosis, or that Zoladex is Zoladex, one of the hormone disruptors, which puts you into chemical menopause, is chemotherapy. It's not. And I think for me, I just really want to make sure that the information that is out there is true, and people don't just kind of redistribute stuff that they've heard. I realise I've gone on a massive tangent.
No, can I just say that is like so amazing, because it's like you have put out all the information that you wish that you would have had access to. And that's that's so important. And that's really inspired me, because one of the things I mentioned earlier about doing a little side project, and it's called ADHD, EFG, HIJK, LMNOP. And it's all the other things that go along with ADHD. And it's going to be like a video podcast series. And it is exactly that, of putting out the information that is right for people. A lot of the resources that are out there are either written by men or with men, or they're really Americanized. So to have someone who is a woman and who is in the UK and who can say it from Patricia's point of view, that's so important and so amazing. So yeah, well done. And you've even though I've already got this idea and I've planned it all out, that is like just another little confidence booster to be like, yeah, this is so important to share that with other people. So thanks for doing what you do. I'm going to make sure I become a follower, because I hadn't heard of the Endo Monologues, and now I'm so pleased because now I'm like,
yeah, it's funny, isn't it? Like, you start something, and I genuinely just started it for my own mental health, but I just find it so amazing. People reach out and say, well, my doctor's told me this, or my doctor's told me that, and I'm like, where on earth is your doctor training? And it literally, there was a thing on one of the NHS apps, the one where you can get repeat prescriptions, and even the definition on this NHS app about what endometriosis was wrong. Like, and you just read it and you think, oh my God, that's a trusted source, and yeah, I really wish that someone had sat down with me when I was in my teens and said, look, this isn't normal. This isn't what you should be going through. And even now, you know, that doesn't happen. It's still not happening. There's movement, but there's not enough. Like, there should be education to say this is what your period should be, and actually education that we can challenge our doctors and that we can ask for second opinions, third opinions, fourth opinions. And I think for me now, you know, I can go to the doctor and just say, oi, you need to refer me to gynae. I wouldn't have done that 5-6 years ago. I would have just kind of said, well, gone with what my doctor has said. So yeah, I'm always amazed by how many people I've been able to connect with via the endo monologues. And I always find it so emotional when people say, you know, thank you so much. And I think for me, it's just knowing that I'm not alone, but also showing other people that they're not alone either, that there is this wonderful community that where you can be honest and you can be open and not have to worry about being judged about it.
Yeah, I just wanted to go to Sarah there and ask if, when in your clinic, do you get a lot of women coming to you with kind of similar symptoms, or maybe don't know what's going on with them? And like Laura said, she had vulvodynia for 2 decades and didn't know.
Yes, I think generally in sexual health, we see people who are maybe have not got the care that they need from their GP or needed to access a service quickly. And because of the nature of the questions we ask are so detailed and so personal, by the end of it, and then you've had an examination as well, by the end of it, it's usually when somebody's leaving the room with vulvodynia or vaginismus that they'll say, oh, and by the way, I've got this really painful vulva, or it hurts every time I have sex. And as sexual health clinicians, we know that that is our moment to talk to that patient, even if you can extend for another 10 or 15 minutes and try and catch up as your clinic goes on, because you're clear in acknowledging that there is an issue, that you are going to help them in a follow-up appointment, that it's not something that's going to be resolved in 1 or 2 or maybe even 3 appointments, but there will be an end goal with it, and it will become more manageable, and you know, that we believe them, because if you don't talk about problems or symptoms among your peers growing up, then you're not to know, and you feel like you are the only person in the world with this issue. And then, you know, we start to normalize the conversation around these difficulties. On another note, Laura was just talking there about intimacy. Just to be clear, intimacy doesn't have to be penetrative. There are other ways of being intimate and close with a partner. And I think if you've got pelvic pain or vulval symptoms or vaginismus, this is where the vagina kind of closes up during sex or before you can have sex, then talk to your partner and talk about other ways of kind of creating intimacy with each other. Take the pressure off.
It can have a really big impact on relationships, like massively. A previous partner of mine was like, is it my fault? Am I hurting you? And then they went all like there about it because they didn't understand what I was going through. And then they pick up your emotions. They have to deal with all of that. It can have a massive, massive impact. I'm super grateful for my partner now. He is just, you know, all my partners have been fairly understanding, but my partner now is just like another level, like brings me Philippa the hot water bottle and like looks after me and makes sure that I'm okay. And he doesn't put it on himself. He doesn't make it about himself. It does affect him, but he knows that it affects me a lot bloody more, and I'm the one living in this pain, and he's had to sort of come to terms with that. And he's just like an absolute diamond with it, because like sometimes I'll be like, don't even look at me, never mind touch me, like I'm just like, no, not in it at all. And other times it's fine and I can get on, and then I'll be in the middle of sex and be like, I can't carry on anymore, this is too much. And it's having to put up with that that can be quite challenging for some people. So just big up all the partners out there, whether they're like full-time or just for a bit of fun. Big up all the partners that are understanding for this, because it's does have such a huge impact.
I think as well, as Sarah was just saying, like the idea of sex not being intimacy is so important. I saw that, I think it's Freya just said in the comments, you know, I'm in exactly the same situation. If we are planning to have penetrative sex, I have to like do a full half an hour preparing for that, and it just completely kills the romance. But I think as well, you learn with any gynecological condition, actually, as Sarah said, intimacy isn't always penetrative sex. You know, you can have a lovely sex life and still not actually have the penetration side of it. And I think that I think I'm speaking from experience, but it goes back to me for that shame of, you know, that area of my body isn't working the way that it should be. I'm feeling guilty in my relationship because I can't necessarily provide what my partner wants. I mean, I'm the same as Abby. I'm with an absolutely wonderful partner, and he's actually been with me since my first laparoscopy, so he has been through it all with me. And I just can't stress enough, you know, if you don't let them know how things are, how you're feeling, it's just really difficult. Like, sometimes you just have to say, like, you know, it hurts, you got to stop. And taking the time to be intimate, I've kind of zoned out, sorry, ended up not thinking things through. But yeah, sex doesn't always mean penetration, is where I was going with that. And don't be afraid, like, if you need to use, I mean, I have to admit, since I've started using cannabis, I have been significantly less stressed about the idea of having sex and the idea that it's going to be difficult. So that's also been a benefit for me as well. But there are ways around it, you know, and I think cannabis can be a great help in that area too.
Get yourself to this. Just smush it all over your coochie and you'll have a great time. I'm so grateful for this, I tell you now, like, honestly. I don't have sex very often, but a bit of balm. My friend would be laughing because she made this for me. I bet she didn't know I was using it for that.
Yeah, thank you both for that. I'm really glad you brought that up about penetration isn't the only type of intimacy, because I think we never talk about that in the wider conversation. So that's really important. Does Sally or Sarah or anyone want to say anything else on this just before we kind of open up for questions? I'm just conscious of the time, but Sally, I don't know if you want to add anything or.
Glad they are, Abby and Laura, they are very right actually, that this kind of chronic pelvic pain has a huge impact on relationship, and women always feel blaming themselves that they cannot provide what they are supposed to provide, and this will end up having a huge impact on relationship. And you have to have an understanding partner. So because if you don't have an understanding partner, the patient or the woman will have a severe psychological impact actually. So having an understanding partner is a huge benefit for a woman with chronic pain actually, because I see it every time I go to my clinic, that, oh, thank you that you opened this. Do you have the sexual life? Is it okay? Oh, you are the first one to ask me this. Oh, no one asked me about this before. Oh, no, it's not. We don't have sex because I can't have it. It's painful. But my partner is he's understanding that I can't do it. So it's having a partner that understands you. It's really a great benefit for a woman who lives with chronic pain.
I think a lot of women in chronic pain are afraid to get into relationships in the first place, and a lot of women that I know question whether they're asexual because they just can't enjoy sex. And that's like a big thing for a lot of women, is like, wait, am I even into sex myself? It's something I've questioned, like, I don't know what my sexuality is sometimes because I feel like I literally can't enjoy sex, and other times I'm like, there's no way that I'm asexual. But it's something that's definitely crossed my mind, and I know but I used to go to an endometriosis support group, and a lot of women were like, my partners broke up with me because he didn't understand, or they didn't understand, and then they don't feel comfortable getting into a relationship with another person because of all of those experiences. And that's really sad. It's something I struggled with. I felt as though what do I do now? Unfortunately for me, naturally I met someone and it just happened, but there's no way I'd have put myself on a dating app or a dating site or purposefully gone out to find a partner. I was fortunate that I met someone through usual life circumstances and they're just brilliant, but it was something that made me go, oh, okay. I mean, it's my partner I was with at the time I was diagnosed with endometriosis. It kind of felt like he stayed with me because I was having surgery, and then I'd got that out of the way, and then within a month he was gone. And we were young. We were 22, 23, and I don't think he understood like what was going on. He didn't. How could he understand? He just thought, oh, she's in pain, it's hurting, we can't have sex, and he didn't understand the impact that was having on me. And yeah, it was a big thing for me then, trying to get into a relationship again, because how do you open yourself up to potential pain, and not just physical pain but mental pain of dealing with this, explaining it to someone else what you're going through? Like, it's traumatic enough knowing it yourself, but to have to go over it all over again. I've got over the trauma to a point I can come and do a talk like this now, but there's been women and people typing saying that they're in tears reading this because it's so resonates with so many people.
Yeah, I just wanted to move into the questions from that, because there is a question that says, what can men do to help tackle the barriers that women face when trying to access healthcare, and what place, if any place, do we have to challenge these issues, and how best can we support women? Anybody's welcome to answer that.
I think, speaking from experience, that just taking the time to research it as well. Like, my partner, the first thing he did was went away and researched everything that I had, and so he had a better understanding. But that's just from my point of view as a patient. I didn't mean to interrupt.
No, I was just going to say, like, we need to normalize the conversation among girls and boys from school age. We make it a widespread conversation, so it's not just a woman's issue, it's everyone's issue. But that's going to take a while before those children reach adulthood. In terms of partners, I think, you create spaces to acknowledge it and to support your partner, take them to appointments, ask them what they need, kind of acknowledge that maybe for 15 days of the month, your partner may not be able to go to work, they may not be able to make money, they may not be able to help with school responsibilities or children, like, don't hold that against them, don't make them feel inferior for it, because it's a woman's issue, acknowledge it like you would any other kind of illness. It's not just in the mind, and I think that's the main thing that I often hear from patients.
Yeah, like, education is key. I remember my old housemate, bless him, and I'd moved out and I was living with a partner, and he messaged me and he was like, oh my gosh, I'm crying my eyes out. I've just been to an endometriosis ball and I've learned all about endometriosis, and I am so sorry that I didn't do that when we lived together. I was so sorry if I was ever a dick to live with. I've sworn I tried so hard not to do that. If I was ever annoying to live with, or if I didn't understand, or if, I'd left my washing up and you couldn't do it. And he was just so apologetic. And all it took was one evening of him going and listening to some stories like this. So what I would say is, share podcasts, share the Endo Monologues. Everyone, in fact, that's attending this should get that link to the Endo Monologues and share it. Why wouldn't you? Give some credit where it's due to the women that are going through this, and by sharing our stories and hearing us as patients, more and more people will understand and listen and engage. And I think that is the biggest thing that anyone can do, men in particular, when it comes to challenging the stigma around this. Share the lived experience from other people.
Yeah, I'm just going to move on to, there's a question here which is probably for Sally. she might not know the answer, but why is the endocannabinoid system not included in medical training?
This is like a question I don't know how to answer it. I'm old. So when I finished medical school, this was 30 years ago. So it wasn't in the curriculum. Why hasn't been added? Maybe they've divided it as important. I don't know, but I didn't know anything about endocannabinoid, I have to admit. Maybe they're starting to add it now. But when I finished medical school, as I said, this was like 30 years ago. I don't know why they didn't add it in the curriculum.
And just to follow on from that, another question we had is, there's still so much fear and stigma around cannabis among medical professionals. How did your colleagues react when you told them you were moving to prescribe cannabis? And did you find it hard to convince them that it was something worth doing?
This is for me, yes? This is me now?
Yeah.
As I said 2 years ago, I had a patient, as I said before, that she told me that she tried cannabis, the street cannabis, and she found it very beneficial. And I asked my colleague, can I just send her to this? Because this, when the UK started to legalize cannabis, and he said, no, don't even mention it. But I said, but it did help. And some of them, so this is one of the doctors, and some of them, they start to believe in cannabis, especially now when they see how very beneficial cannabis is, and it can be a life changer. So everyone is acting differently.
Yeah. For Sarah, I'm going to ask this too. Someone says, having been on pain medication for decades and having 2 addictions that I have beaten with cannabis, I'm scared to tell my GP about cannabis as I already have drug seeker on my records. How do we beat this stigma?
Yeah, that's tricky. I mean, I think you need to go in armed with what the benefits cannabis has given you, what symptoms they've controlled for you. And how exactly that you're using it. Talk about what other daily activities you're doing. If you can involve the nurse in your clinic, ask them. Nurses are there to advocate for patients. And if you're unhappy with the response, see a different doctor.
I think it's important to let your doctor know that you've read about the negatives of cannabis as well, because they've already got that in their mind. Just reassuring them that you've looked into this. And again, I've put a link to a resource around talking to your doctor, because we get asked this a lot. And I think keeping calm and relaxed and trying not to get sort of overwhelmed by it. I mean, Drug Sciences Project 2021, they are treating substance use disorder as part of the project, and patients are being prescribed medical cannabis. So using examples such as that, and where patients are already receiving this, might help just with that specific question.
I agree with Abby. The 21 project, they are treating people with substance misuse, yes, with cannabis now.
Yeah. And just to kind of lead on from that again, what is missing in terms of access to sufficient amounts of the legitimate products once you get past the hurdle of getting an actual prescription, which Abby sort of slightly touched on at the beginning. I don't know if you want to talk about some of those issues, maybe.
Oh, find me unmute button. I can't remember what you said now because I was looking for
It's all right. Well, we are like really short on time, so I'll just do it really briefly. But what's missing in terms of the access to the sufficient amount of legitimate products once you've got a prescription?
Starting low and going slow is the big thing in all medication. That's not unique to cannabis, but making sure that you are journaling, I think, what you're taking and why and what the symptoms are will help you to talk to your doctor about wanting an increase. When it comes to the importing problems, the only thing you can do there, I guess, is write to your MP and tell them this is ridiculous. Patients are being prescribed this medication, then going 40 odd days without it because there's been an import issue and things like that. That's sort of a bit further beyond our control. But by normalizing that conversation in society in general, I think will allow for better importing, and even growing in products that are manufactured in the UK will be more easily available the more that we talk about this and legitimise it.
Yeah, I've just seen another really good question I'm just going to ask before we close is to Abby and Laura, has your diagnosis affected your decision to start a family?
Yes. Yes, it is something that is constantly at the back of my mind. I mean, I'm 30 and I've already had to have conversations with my other half because I got to plan, because the problem is I have the Mirena IUD, which significantly has helped my symptoms, but then I have to end up making a decision that I have to remove that and then potentially make my endometriosis come back with vengeance to then be able to have a family. So I think it's something that I'm always aware of, and something that I think I'm preparing it to be difficult to start a family. In the past I really struggled with it and I got quite upset, but now I'm like, what will be will be. But I think it won't be a spontaneous thing. I will have to plan with my other half, right, we are now going to start trying for a family, and being mindful of the difficulties that could come alongside that for myself.
Yeah. For me, I never wanted children because I found myself in this situation of, I don't want to pass on all of these struggles. I was also told there's a 50% chance I could be infertile. And it wasn't something that I wanted, you know, it kind of put me off. It made me go, oh, okay, well, okay, I won't do that in my life. But now I'm with the partner that I'm with, that conversation has very much flipped on its head, and it's something that we absolutely are now. We are talking about, and hopefully will happen for us. But it is something that has been for a long time a big no, because of being sick, because of not managing myself. So how would I manage being a mother? But now I've come to terms with, well, you know, what else are we on this planet for? If I want to try and be a mother, I'll try and be a goddamn mother. So wish me luck with that one.
Yeah, thank you, and absolutely absolutely best of luck with that. Just before I go, I'm going to ask for a closing statement from each of our panelists, so something that you want the audience to take away from tonight's show. So I'm just going to go in the order on my screen. So Dr. Casella, what would you like to finish with?
So for all women with any kind of pain, pelvic pain, just listen and listen and listen to them. And this is my message for the day. And if you don't, as Abby said, if you don't keep talking about, nothing will be will happen. So just keep talking and spread the word, basically.
Yeah, Abby?
Nothing about us without us. Patients have lived experience, and patients are the ones that should be listened to, even if you're not yet labeled as a patient because you didn't get as far as getting treatment because you're not believed. Listen to people with the lived experience and share their stories. Normalize this conversation. We all have periods. We only exist because of periods. That is a line from my stand-up comedy. And yeah, just really nothing about us without us.
Love that, thank you. Sarah, what would you like to add?
I'd just say, if you're a nurse and you identify a patient that's using cannabis, explore and see if they're using it therapeutically. If you're a nurse and you're curious about cannabis, but you're not really too sure where you stand about it in terms of talking to patients about it, go to CPAS's website, check it out. It's an organisation run by nurses and educators on a voluntary basis. So it's non-biased information that we put up.
Brilliant, thank you. And Laura?
I think for me, it's just knowing that you know when something is wrong with your body, and being confident, you know, and remembering that you don't have to trust the advice of the first doctor you speak to. You are entitled to as many opinions as you like, and I would also suggest, especially if you're a patient, having a diary of all your symptoms that you experience on a day-to-day basis, because quite often doctors can be intimidating, and actually if you go and present that to the doctor and say, this is how I felt on this day and this is how I felt on that day, they can't really argue with that, and it gives you a reference point. But yeah, for me, it's just what everyone else has said, you know, talk about it, share the information that you get, and don't be afraid to, you know, be honest about how you're feeling and your body, etc.
Yeah, thank you. I think there's some really good sort of takeaways there, and hopefully everyone's found this useful. I just want to thank all of our panelists for taking part, but also everyone that's been messaging in the chat. I've kind of been keeping an eye on it on the way through, and it's really nice to see so many people resonating with what we've talked about. There is quite a lot of resources in there already. I think there's some links to the organisations that are involved tonight in Project 2021 and things like that. But we'll be sending out an email afterwards as well, so all the details will be on there. And I'd just like to thank you for joining us, and if you keep your eyes peeled, our next event on cannabis and motherhood will be coming up in around July time, we think. So yeah, keep your eyes peeled for that, and hopefully we can continue the conversation then. So yeah, thank you all so much.